All right, prochlorperazine or Compazine. Pyrazine. Prochlorperazine or Compazine. This is a phenothiazide. Its action is to suppress the CTZ, okay, so we're suppressing the CTZ, which is the chemoreceptor target zone. Okay, so this is an area in the medulla, in the brain, that measures the bloodborne medications, signals, chemoreceptors, or chemotransmitters or messengers that tell the medulla to induce vomiting. Okay, so it's an area of the medulla that induces vomiting or tells the stomach to reject whatever the contents are based on what the blood-borne chemistry is saying or medications. So we're suppressing that area. So this is an anti-emetic. We do not want, this is what we give to not vomit, right? Okay, so it also has antihistamine effects. Okay, antihistaminic effects. Okay, so what would we give Compazine for? Well, we would give Compazine for nausea, vomiting, anxiety, and psychosis. I have never seen it used for psychosis or anxiety, to be totally honest with you. However, I've seen it used for nausea and vomiting. I've also seen it given prophylactically for medications that do give nausea or cause nausea and vomiting when unresponsive to Zofran, for example. So now the antihistaminic effects are the sedation effects. It kind of has that sedative quality to it, which is going to calm anxiety and calm psychosis. Okay? So, we're going to give this 5 to 10 milligrams. Okay? 5 to 10 milligrams. It can be given IV, IM, IO, or PO. You can buy Compazine over the counter, or Dramamine is something very similar. So I guess it's not Compazine specifically, but you can buy similar medications over the counter that are lesser strength, lesser potency. Our adverse effects are, as you would imagine, drowsiness and dizziness, sedation, dry mouth, and extrapyramidal symptoms. Okay, so it does not have all of the antihistamine effects. It just has the sedation, and the ability to give dry mouth. Okay, so what are our I guess those were our adverse effects, our contraindications for Compazine would be allergy to the drug, small children, and pregnancy. It can potentiate CNS depressants. So this can potentiate or make them stronger or make their effects more worse with CNS depressants. So we'll use with caution in the presence of CNS depressant. Okay, what would be a CNS depressant that we would worry about? Alcohol is the biggest one. There's plenty of other illicit drugs that are CNS depressants as well. Those are some that we'd consider using caution with, or just not using with this medication at all. Compazine, I don't believe, is carried on ambulances very often. Sometimes it may be. It just depends on local orders and med control. But these are the highlights.